We were there as workers covered the emergency room signs at Midcoast Medical Center in Trinity, Texas. The sight of medical workers leaving for the last time, signaling this is one of the latest rural hospitals to shut its doors.
I think how sad it is.
Marjorie Polvino runs the hospital board.
It has a huge impact on the committee. We will lose lives. 400 people a month come here.
By now, I think we've all heard about the House GOP approved budget cuts to Medicare and Medicaid. If you're thinking, hey, I have private insurance, how does this affect me? It totally affects you. This affects you because it's going to limit your care and your access to care. Most hospital systems, especially in rural communities, rely on Medicare and Medicaid payments for up to 2/3 of their budget. Whether you're going to the larger hospital in the community for cancer care, primary care, urgent care, or labor and delivery, all of this affects you because your local clinics may be run by a larger hospital corporation. Most of our healthcare in the U.S. is largely run by larger hospital systems in our communities. These cuts can lead to hospital closures. And it's not just the large hospitals themselves closing. We're talking about all their peripheral satellite facilities closing too, like radiology, primary care offices. And what this means is that you are going to be traveling farther for all your care. For example, Martin General Hospital in Williamston, North Carolina, shut down in 2023. Now everyone has to drive 30 miles or more to get to an emergency room. Madera County Hospital in California shut down in 2023 as well. Everybody within a 30-mile radius, 16,000 residents no longer have access to any kind of emergency care. And you don't even have to be in a rural community to feel its effect. Think about your local provider for cancer care, GYN care, pediatrics. If that clinic shuts down, how much farther do you have to go to get any sort of care? It's important to understand how policy changes can affect the care that we receive and have access to in all of our communities. So pay attention and speak up. Contact your state and federal representatives and let them know how these healthcare cuts can affect your community. Your voice matters.
Small town America is waking up to something they didn't see coming. The hospital down the street is closing, not because of mismanagement, not because of some random economic decision, because Medicaid funding just got gutted and rural hospitals run on Medicaid. That's just the reality of how they survive. And these are the same towns that voted for Trump by 4-0, 5-0, 6-0 points. These are the communities that put him back in office. Loudest at the rallies, first in line on election day. Now the nearest emergency room is 45 minutes away, an hour, sometimes more. They're panicking now, calling their congressman, showing up to town halls, asking what happened. What happened is exactly what was promised. They just didn't read the fine print.
Today is a little serious for me. You can officially say that you know or you have seen someone who no longer has health insurance. My Medicaid was cut off after 15 years of being on Medicaid. I no longer qualify, according to the administration. I require for my life medications. I take 23 pills a day. From about a dozen medications. My total bill, if I were to buy them myself, which I can't afford to do, but it's $1,168 a month for my medications. I am not going to be able to afford that. I just afforded what I could. I got 7 medications out of 12. I can't buy the other ones. Some of them are just way out of touch. There's nothing I can do about it. There's no one to reapply to. There's no one to complain to. There's really, I'm shit out of luck, basically.
So spot on about this, and I live in a rural state. I live in Nebraska, and I know also that the other thing that's going to be cut and that's going to close down in these rural communities is long-term care facilities. And we experienced this with my stepmother, who had Alzheimer's and was in a memory care facility in Nevada, Missouri, that we fought. We put a change.org petition together, my dad and I, and we all advocated, my sisters and I, and the community advocated to keep the Alzheimer's Care Center open, and they the hospital eventually closed it down, and they had this long-term care board, and then they were going to put the patients in this horrific place, and many had no choice because they had Medicaid, so they were moved and transferred there. And of the, I can't remember how many were transferred there, that like a great portion of those folks ended up dying within a very short period of time. But those places are even going to be closed down. So this is absolutely horrific. And these people who voted for him, who didn't think about anybody but themselves, are now going to FAFO, right? Because I mean, we all are touched by these issues in our families, and they're going to be left with, you know, maybe having to figure out how to care for their elderly family member who has dementia.
She just told you exactly what's coming, and nobody is ready for it. Long-term care facilities, memory care, nursing homes, all of it runs on Medicaid. All of it is on the chopping block right now. And Trump signed off on every single cut. And she lived this already. Before the cuts even hit, her stepmother in a memory care facility in Missouri, they fought to keep it open. Petitions, advocacy, community showing up, and it's still closed. And the patients who had Medicaid had no choice where they went. They got transferred to whatever was available, and a huge portion of them died shortly after.
The rural health care crisis here in Oklahoma has hit a breaking point this week. The town of Clinton, Oklahoma is having to give its local hospital $200,000. The city itself is having to give the hospital that money to keep it from shutting its doors. The hospital was about to not make payroll this week. It's all after the hospital, these rural hospitals have never really been profitable because just by their very nature, they don't serve that many patients. And this hospital was trying to sell to a private company that would have been able to buy it and operate it without having to shut it down because they could move money from their other hospitals where they do make money to this Clinton hospital to keep it going. But that sale fell through this week. And what's interesting is that this all kind of ties in with the uncertainty we're seeing over rural healthcare right now. With the cuts we're seeing to Medicare and Medicaid, rural hospitals don't really know if they're going to have that income flow to survive moving forward. And companies that might be thinking about buying them are now kind of getting cold feet on, is this something that we can really afford with these cuts coming to Medicare and Medicaid? 28 of the 71 rural hospitals in this state are in danger, critical danger of shutting down by the end of the year.
My daughter's speech therapist went out of business because Medicaid reimbursement rates were too low. We do not have Medicaid. I'm going to keep posting this until people understand that when Medicaid gets cut, everyone loses services. What a lot of people don't seem to get is that Medicaid is not just for other people. It is baked into the entire system. When Medicaid takes a hit, everyone feels it. Services disappear, clinics close, wait times will explode. Therapists, doctors, even home health aides, they're going to burn out or they're going to leave the profession altogether. And not because they don't want to, but because they literally cannot afford to keep helping people. And this affects way more than just low-income families. Think about rural communities, elderly people in nursing homes, disabled adults, kids in school who need speech or occupational therapy. All of that gets gutted when Medicaid is underfunded. Schools lose specialists, hospitals shut down departments, emergency rooms get overwhelmed, and then guess what? Private insurance prices go up, because they're covering the gaps that are left behind. Even if someone has private insurance, they might still rely on Medicaid-covered providers without even realizing it. You might go to a clinic that takes all insurance, but if they lose their Medicaid patients, they can't keep the doors open. So now you just lost your provider too. And then people wonder why mental health services are impossible to get, why there's a 6-month wait to get a kid into speech therapy, why nursing homes are understaffed. Medicaid is the infrastructure. You pull one little thread and the whole thing starts to unravel. This parent is right to keep posting about it because cuts to Medicaid don't just affect them, they affect all of us, whether you want to admit it or not.
This woman doesn't even have Medicaid, and her daughter's speech therapist just went out of business because Medicaid reimbursement rates were too low. And I need everybody to sit with that for a second, because this is exactly what nobody wants to talk about when they're cheering for government cuts from their couch. She's not on Medicaid. Her family doesn't use Medicaid. She probably never thought Medicaid had anything to do with her life. And yet here she is watching her daughter lose access to a service she needs because the entire system that keeps that service financially viable just got pulled out from under it.
Nearly $2 billion gone overnight. No warning, no transition, just termination letters. That is not exaggeration. Late last night, the Substance Abuse and Mental Health Services Administration sent hundreds of letters canceling federal mental health and addiction grants effective immediately. Programs across the country were told that as of yesterday, that the funding keeping their doors open no longer exists. Street-level mental health care, overdose prevention, peer recovery services. Some providers are being told they may have to shut down tomorrow. According to NPR, the total cuts could approach $2 billion. One national recovery organization alone lost about $500,000 overnight. No phase out, no safety net. And this is the part that matters. These grants sit on top of Medicaid funding. Medicaid was already cut last year by a Republican-controlled Congress. So this is not a single decision. This is a coordinated dismantling. As a nurse, I really need you to understand what this actually means. It means overdoses that would have been reversed will not be. It means people in crisis will end up in ERs, jails, or body bags. And it means the safety net did not fail. It was cut on purpose. The letters say these programs no longer align with the priorities of the Donald Trump administration. Overdose deaths were declining. These programs were working. This is not fiscal responsibility. This is policy with a body count. Elections have consequences. Budgets have casualties. And this one will be measured in lives lost.
Let's pretend you're a hospital and see how the Big Beautiful Bill Act affects you. You own an average run-of-the-mill hospital. Two patients come in and they both need emergency medical care. One patient has commercial medical insurance, the other one does not. The care for both patients costs $2 each. $2 for patient one and $2 for patient two. For patient one, you go to their commercial insurance payer, you negotiate, you get your $2 back. Patient two can't pay the $2, but because the government knows that they're living in poverty, they agree that they are going to pay you, the provider, the $2 on the patient's behalf. The costs are $4. You have $4 in your hand. Now, let's say the government says, you know what, we're actually not going to pay for some of these patients. So the next time when the two patients come in, your cost as the doctor is $4. Now, you get $2 back from the commercial insurance payer, but these other $4, the government says, we're not paying that. So what do? You go back to patient one and you say, hey, unfortunately, I'm going to need $4 from you, patient one. Even though your care only costs $2, I'm going to need $4 because I need to cover all of these costs. Now, let's take this a step further and assume that you, Dr. Jean, you are a doctor who owns a rural hospital instead. So now, instead of half of your patients having commercial insurance and half being under the poverty line, now both patients are under the poverty line. So now the same two patients come in and they both need emergency care worth $2 each. Now you don't have a commercial insurance to bill for any of this. And also the government said, hey, we're not going to let you bill us for this either. So what do you do with your $4 costs? Nothing. You can't pay your doctors, you can't pay your bills. And so eventually these $4 build up and you close. Not patient one and patient two who had to come to you for emergency medical care, except now that you're closed, now they have to go somewhere else, somewhere further. If they make
This woman just explained the entire American healthcare collapse in 2 minutes using $4, and I need everyone who voted for the big, beautiful bill to watch this video until they actually understand what they just did to their own communities. Because this isn't complicated. This isn't some liberal talking point or socialist agenda or government overreach. This is basic arithmetic that a 4th grader could follow. You have costs. You need revenue to cover those costs. When the government stops paying its share of those costs, you don't magically find the money somewhere else. You either shift those costs onto people who already have insurance and watch their premiums explode, or you close your doors and leave an entire community with nothing.
Nearly 300 healthcare workers are about to lose their jobs, and it has absolutely nothing to do with performance. Oakland-based Alameda Health System is laying off 296 employees because of federal funding cuts tied to H.R. 1, which is also called the One Big Beautiful Bill. So this law, as a reminder, tightens Medicaid eligibility and cuts key safety net funding. And here's the part policymakers never say out loud. Medi-Cal makes up about 60% of Alameda Health System's payer mix. So when Medicaid gets cut, hospitals like this do not have a backup plan. They have layoffs. So by 2030, AHS is projected to lose more than $100 million every year. Starting in 2026, disproportionate shared hospital cuts could strip another $60 million annually. So that money pays nurses, techs, environmental services, case managers, and support staff. So when it disappears, so do jobs and patient access. So yes, the system is offering severance, retirement incentives, and resume help. But let's be honest, that does not replace a stable healthcare workforce. So as a nurse, I need people to understand this. You cannot cut Medicaid and expect hospitals to magically survive. You cannot defund safety net systems and still claim patient care is protected. So this is not politics on paper. This is what healthcare collapse looks like in real time.
You think these Medicaid cuts aren't going to come for you? They sure are. Medicaid is a major funding source for all hospitals, especially if you live in a rural area. Without these funding dollars, your hospital may close. Your ERs may close while the hospital stays open, but for emergency care, you'll have to travel farther. Need a specialist? They may be farther away too. And if your hospital doesn't close, if the neighboring town's hospital closes, guess who's coming into your town to use those resources? This leads to more wait times even for you, even if you have private insurance. U.S. political propaganda makes you think that universal health care would lead to longer wait times. Honestly, how long are you waiting for your doctor's appointments? I have stage 2 breast cancer, and I've had to wait weeks and sometimes even a month or more for urgent care related to my cancer. Chances are you already have to wait weeks and months to see a specialist right now with your private insurance in America, in this current healthcare system. Oh, by the way, you might actually be on Medicaid and not realize it. Medicaid dollars subsidizes plans in every state, and every state has rebranded it, so it's not just called Medicaid. Are you on Fidelis, WellCare, United Healthcare Community Health, Health First, Metro Plus, CanCare, Apple Care, Hoosier Care? If you're on any of these healthcare insurance programs, this is going to affect you. Healthcare is a human right. We are already paying the price for a system built on profit. People who don't have insurance still get sick, still go to the ER. They just can't pay their bills. That hospital has to eat the cost, and they eat the cost and they raise their prices for you if you have private insurance. Medicaid cuts hurts all of us. Not having a universal healthcare system that supports all of us is a problem in America. Your wait times in America are just as long as wait times in other countries that have universal healthcare. We are just paying more out of pocket. Think about how much you pay in your copays, even though you pay a premium. Other countries don't have to pay this. Don't be fooled. Medicaid cuts hurt all of us. Healthcare is a right.
This woman has stage 2 breast cancer, and she's still taking time out of her day to explain to strangers why Medicaid cuts are going to hurt them personally. And that point about not knowing you're on Medicaid is the most important thing in this entire video, because there are millions of Americans right now voting to cut a program they are literally enrolled in because the branding was so successful they didn't recognize their own insurance plan. Fidelis, WellCare, United Healthcare, Community Health, all Medicaid, all on the chopping block, all affecting you directly whether you want to admit it or not.
So you need to reach out to those U.S. representatives at the federal level. So those are your U.S. senators and your U.S. congressmen, okay, here in Kentucky. Also, they're the ones that are in D.C., right, taking votes on this. You also need to be reaching out to people like myself at the state level. So that is your Kentucky state senators and your Kentucky state representatives. Those individuals need to know that you are deeply concerned about this, because here's what's going to happen. When those federal cuts start happening, Kentuckians will rightfully so look to us at the state level to say, what are you going to do about this? And we're going into a budget year in 2026, so we are preparing for that now. And the money's got to come from somewhere, and we don't have a lot of money in this state. And what is saved up we could blow through pretty quickly. So this is really important that you're putting that pressure on the folks at that U.S., at that federal level, for those representatives that are representing you in D.C., but also make sure you reach out to your people here at the state level.
We have some big news right now. Rural hospitals in Virginia are set to close soon because of Donald Trump's big budget bill. According to the Augusta Medical Center, 3 rural hospitals in rural Virginia will soon be consolidated as a result of the impacts of the bill. Virginia is set to lose $29+ billion in Medicaid funding as a result of the budget bill that was passed and signed into law earlier this year. And we're now seeing the impacts. We're seeing the impacts with rural hospitals closing. That's just the beginning. We're going to see more rural hospitals closing, not just in Virginia, but across the country. We're going to see more people lose access to healthcare, more people lose access to Medicaid. This is just the beginning.
We all know the Senate is currently debating the nasty, horrible, awful bill, and they will probably be voting on it tomorrow. If that goes through, I realize that my hometown hospital will be at high risk of closing. Not only that, but another one that is close to it will also be at a high risk of closing, meaning 3 communities would be going to 1 hospital. So here's what that would look like. You already think you're waiting a long time at the ER? Well, that's going to go up because there's going to be more people trying to get into this 1 hospital. And then think about the ambulance. If you need an ambulance, depending on where you are, can they get to you? And if they do, it's just going to be a lot more of a delay. And what if you need surgery? Just all of that, there's going to be a lot more people that's going to be backed up. And there will definitely be a staffing shortage because there's going to be an influx of patients. And if they do hire more people, how are they going to get the beds to put you somewhere in the ICU or wherever you need to be? Just because they hire more people doesn't mean they have a place to put you. There's going to be a longer travel time for people to get to the hospital. So what if you are a pregnant woman or somebody that you care about is pregnant and their water breaks and they're going to have to be traveling an hour, hour and a half, 2 hours to get to the hospital? And I also think about elderly patients like my parents. My parents still live by where this hospital is most likely going to be closing. They're going to have to travel a lot longer if they need care. And the burnout risk of the staff that is there now having this influx of 2 other communities going on to their hospital, that's going to be huge. There are around 338 hospitals that are at a high risk of closing if this bill goes through. I'm going to put a link of the list of those in my link tree, so go check it out and see if there is one that's going to be close to you. There is still time to call these senators and just basically say, why do you hate your constituents? Why are you trying to take away all of this care from them? And put the pressure on them. They are going to want to be reelected. And so we need to let them know that that's not going to happen if this terrible, awful, horrible bill goes through.
338 hospitals at high risk of closing. And I need everybody to understand what that actually means on the ground in real human terms, because this isn't an abstract policy debate anymore. This is a pregnant woman's water, breaking an hour and a half away from the nearest hospital because hers just closed. That's not a statistic. That's a death that didn't have to happen. And this woman is describing exactly what happens when you consolidate 3 communities into 1 hospital overnight. The math doesn't work. You can hire more staff, but you can't manufacture more beds. You can't manufacture more ICU space.
I'm so tired of hearing Republicans talk about giving health care to illegal immigrants. Let's talk about this. Immigrants aren't getting any money. This is reimbursement that's going to the hospitals. The hospitals that would otherwise be on the hook for thousands and thousands of dollars in uncompensated care. Do you think that hospitals have a pot lying around with all this extra money? They are squeezing every nickel out of the system, just trying to keep the lights on. Do you really want all of the rural hospitals to close? Is that a really sound like a good plan? If you haven't noticed, our healthcare system is on fire. We want to kick off millions of people off of Medicaid. We want to reverse all of the ACA subsidies. And you know what that's going to do? That is going to close hospitals. That is going to take healthy people out of the pool. And that is going to make care more expensive for everyone. I don't know how you could hate a group of people more than to cut off your nose to spite your face. It blows my mind. They are people. And when people are sick, they get treated. Because that's how we do things in America. Get your heads out of your asses.
Hey, New York, on June 12th, 2025, a group of senators wrote a letter to the majority leaders and Donald Trump with a report on which hospitals they're anticipating will have to close because of Medicaid cuts. I have that report pulled up, and I thought folks might be curious to know which hospitals in New York are on the list. Wyoming County Community Hospital, Newark Wayne Community Hospital, Geneva General Hospital, Bon Secours Community Hospital, and Port Jarvis, if you know how to pronounce that. Tell me in the comments. Westfield Memorial Hospital, Claxton Hepburn Medical Center, Messina Memorial Hospital, Garnet Health Medical Center, Clifton Fine Hospital, Gouverneur Hospital, and Lewis County General Hospital. I know for at least Lewis County, that's the only hospital in the entire county. If this will impact you, if it's something that you're worried about, currently in the New York State Senate is the New York Health Act. This is a bill to bring universal health care to New York State. It includes primary care, specialty care, reproductive care, mental health care, dental, vision, hearing, long-term care. I'm probably missing something else, but it is planned to be funded by a progressive tax. They are anticipating for 90% of New Yorkers, it will still be cheaper than the current monthly premium you pay for your private health insurance. And for those of you who may or may not have seen my earlier videos, if you're not aware, health insurance and Medicare do not pay for long-term health care. Medicaid is the most common payer for long-term care services. More than half of the people who receive long-term care services in the country use Medicaid as their form of payment. So in addition to those hospital closures, it's anticipated that a lot of nursing homes or long-term care providers will also have to close. If you are really wanting to push our New York State electeds to have an alternative put in place before these cuts impact us at the end of 2026, please reach out to your New York State Senator and ask them to sponsor the New York Health Act. Thanks. Love you. Bye.
So let's zoom out and look at everything we covered today, because when you put it all together, it paints a picture that every single American needs to understand, regardless of who they voted for, regardless of what party they Braxtons, support regardless of whether they think they have anything to do with Medicaid or government health care or any of this. We started in Nebraska, where farmers who voted overwhelmingly for Trump are watching their generational farms collapse under the weight of tariffs they cheered for. Watching Tyson Foods pack up and leave Lexington, Nebraska, taking 3,000 jobs out of a town of 11,000 people. Watching China sign long-term contracts with Brazil while their soybeans sit rotting in silos with nowhere to go. Watching the factories close and the equipment costs rise and the markets disappear, and still being told by the people who caused all of it that things are going to get better. And then we move to the healthcare crisis that is quietly unfolding across this entire country right now, while people are distracted by culture war arguments and political theater. A mother watching her daughter lose her speech therapist. A woman with stage 2 breast cancer waiting over a month for urgent cancer care in the greatest country in the world with private insurance. Rural communities about to lose their only hospitals because the math simply doesn't work anymore when the government stops honoring its financial commitments to the people who need care the most. 338 hospitals at high risk of closing. Not in wealthy urban centers. Not in places with multiple options and abundant resources. In rural communities. In small towns. In the exact same places that put up the most yard signs and attended the most rallies and voted most enthusiastically for the people who just signed this into law. And Senator Fisher, touring a healthcare college in Nebraska, seeing the million-dollar equipment, hearing about counties with 0 primary care physicians, understanding the crisis completely, and then walking out of the building, declining. Follow-up questions and telling rural Nebraska to go find a rich donor somewhere, as if there's a billionaire hiding behind every cornfield, just waiting to fund rural healthcare out of the goodness of their heart. And the veteran standing at a town hall microphone asking his congressman why healthcare and SNAP got cut for people like him and getting hit with no taxes on overtime and Happy New Year, like his question was an interruption at a dinner party. And through all of it, the same answer from the same people who orchestrated all of this. We don't have unlimited money. We need to cut waste. We need to prioritize core government responsibilities, while finding $45 billion for private detention centers, while pushing through tax cuts for people who will never spend a single night in a Medicaid-funded facility, or drive 2 hours to reach an emergency room, or wait a month for urgent cancer care, or watch their daughter lose her speech. Therapist because the reimbursement rate was too low,